Good morning, friends. This is Professor Dr. Deepak Jumani here, a senior sexual health physician attached to Sir J.J. Group of government hospitals and Mumbai police hospitals. Obesity and sex, mission impossible. We all can understand what is the mission which we are talking about. But let me be honest. For many patients, in fact every patients who are overweight or having moribund obesity, this is not just a topic. It's their daily reality. The problems which they face, the embarrassment which they face, the guilt, the shame they face. Obesity and sexual dysfunctions is in true sense nothing but the metabolic hijacking of human intimacy. And when metabolism collapses, intimacy is the first casualty. The clinical reality is that obesity is not only a cardiometabolic disease. According to me, it's an intimacy disease. Patients come and tell me, doctor, kuch hota hi nahi hai. Sex life is gone for a toss. So when obesity enters the bedroom, besides the weight he carries, he enters the room with several limitations. It can be physical limitations, hormonal limitations, vascular limitations. And most importantly, what happens is he loses his confidence and self-esteem. What should be natural becomes effortful. What should be pleasurable becomes stressful. And what should be most urged for in any man, he tries to avoid. So in obesity, the problem is not just performance. The problem is participation. But here is where I'm going to change the narrative today. Because what looks like mission impossible today with the advances in the field of sexual medicine, this mission which is impossible will become mission irreversible or reversible or achievable. Because the body is not broken, it can be adapted or adaptable. The system is not failed, it can be altered. And the patient is not helpless because he's simply unaware of the switches which are present in his body. The biological switches, the behavioral switches, the psychological switches. And when these switches are activated, the same body which created the problem becomes a solution. So let me say it very clearly. Today we blame our genes. No, the science of genes have completely changed. Genetics load the gun, but it is epigenetics, so the lifestyle pulls the trigger. So today we are facing definitely a global epidemic of obesity, but along with this, we are silently witnessing sexual dysfunction as a second epidemic. So to understand sexual dysfunction in obesity, we must first understand one truth, that sexual health is not a peno-vaginal event, it's a metabolic event. When metabolism is corrected or when metabolism heals, hormones recover, circulations improve and intimacy awakens. Because mission impossible in medicine today is just a story waiting to be rewritten. It may be by biology, it may be by behavior, or it may be by belief systems. And the courage to change has to be there within us. So the next time when patient comes and says, doctor, kuch hota nahi hai, impossible hai, let us not give him a prescription or let us not send him to a bariatric surgeon. Let us give him a perspective. Because sexual health is not just performance. It is about feeling alive in your body and worthy in your own life. Impossible is not a diagnosis. It is delay in intervention. So today I want to give you some distilled insight into the science behind the hidden connection. How obesity hijacks hormones, damages blood vessels, alters the brain chemistry and ultimately steals one of the most intimate dimensions of human life. And how do we conquer and win over time? Thank you.